What is a kyphoplasty? Well, a kyphoplasty is for a patient that's had a vertebral compression fracture. And what is a vertebral compression fracture? Well, this is a nice model of the lumbar spine. And here are your vertebrae. Each bone is a different segment of your lumbar spine. You have your sacrum, you have L5, L4, L3, L2, L1. And what can happen is sometimes if a patient has osteoporosis or they have a traumatic fall, they can get a compression of this bone, just like you can break any other bone in your body. These compressions are very, very painful. Make believe you had a broken arm and you had to keep using it. You can't stop using your back. You can't rest it, right? Even while you're sitting, you're still putting pressure through that broken bone. So what do? We do something called a kyphoplasty. It's an outpatient procedure. We do it right here at the office. We put some bone cement right into the middle of that bone where that fracture is, and it shores up the fracture. It fixes the fracture almost immediately. It's actually my favorite procedure to do because patients come in with 10 out of 10 pain and usually walk out with 1 or 2 out of 10 pain, and usually within a week or two almost have no pain. So how do we do a kyphoplasty? Well, you come to the office. You're here for about an hour total from door to door. You'll start with the pre-op. You'll talk to our nurses. You'll talk to our MAs, go over all the consent, all the risk, everything of that nature. Then we'll get an IV for you. The reason we give you the IV is for twofold. We want to put some antibiotics through there just because, you know, we're making a little punch hole. We're going down into the bone. We want to make sure no risk of infection. And we're also going to give you a little bit of sedation. We use Versed and fentanyl here. That's just to take the edge off during the procedure. You'll still be awake. We'll still be talking to you. You'll be very comfortable, though, as we do the procedure. So basically, we then get you on the procedure table. You're lying on your belly. We have an x-ray machine that watches the whole way exactly where I'm going, step by step as I'm putting the medicine or the cement into the vertebral body. We do a full sterile drape, and to start the procedure, we may just make a little punch hole through the skin, use the needle to go down through what's called the pedicle here. This is the pedicle. Go through the pedicle, get into the vertebral body, and once we're into the vertebral body, we'll usually take a biopsy. The reason we take a biopsy is a very small percentage, but some percentage of compression fractures could be pathologic. What does that mean? There could be a risk of some kind of cancer in that bone, and we want to make sure. So while we're there, we're just going to take a biopsy real quick. It only adds about 5 to 10 seconds to the procedure. We take a biopsy. We then drill a little access hole into the bone. Once again, you won't feel much of this at all. You may feel a little pressure. We then put a balloon in. This is why it's called a kyphoplasty. It's called a balloon kyphoplasty. We put a balloon in, and what that does, it helps restore some of that height you lost when it compressed down. It helps restore the height and also makes a space for me to put that cement. So if you're looking at it from the top, the access will look like this. Right where the tip of this pen is, there'll be a balloon there that blows up, and that gives me a lot of room to put that cement in and shore up that fracture to get rid of the pain. We then deflate the balloon, pull that out, and we put the cement in. The procedure itself takes about 15 to 30 minutes. You will go to the recovery room, usually recover for about 10, 20 minutes just because you had a little bit of sedation, give you a little bit of food, make sure everything's okay, make sure your vitals are stable. Then we get you dressed, and you head on home with whoever brought you. We'll see you back within 10 days after the procedure just to check how you're doing. But like I said, most patients feel really, really great even walking out of the office.